Hello, my name is Isidore Oliveras, and I'm in the Medical Health Services Management program. This is my practicum presentation for this semester. In this practicum, I started at Bewell Primary Care in Denton, and I'm going to be going over the clinic hours that I have learned and observed from this location. Some of the objectives that I'm going to be going over is the introduction, the practicum experience, communication skills, the weekly meetings, the practicum project, ECW, APCM, and the closing remarks. I completed my practicum at Bewell Primary Care in Denton. It's part of a group with multiple locations, including Alliance, Keller, and Bridgeport. One thing that stood out to me right away was how different staffing levels affected how each clinic operated. I worked closely with the practice manager, Leslie Rodriguez, who really guided my experience. She gave me the opportunity to rotate through different areas like the front desk, medical assistance workflow, and even some ancillary departments. She played a big role in helping me understand how the clinic runs overall, especially from a management perspective. Her awareness of what was going on the day to day helped me become more observant and pay attention to how everything connects. BeWell is also growing pretty fast, so it showed me that there's always room for improvement, especially when it comes to workflow and inefficiencies. On this slide, I'm going over my practicum experience and the main areas I focused on. During my time at BeWell Primary Care, I mainly focused on four things: workflow, how different processes connect together in the clinic, policies and procedures, and data processing. What I noticed is that all these areas are tied together through ECW, which is the system the clinic uses for scheduling, documentation, and billing. And that's kind of why ECW became the main focus of my project because I saw how much it impacts the overall workflow. As I observed different roles in the clinic, I started to see where breakdowns weren't happening, especially when workflows were not followed consistently or when communication was off. Based on that, I was able to suggest small improvements like being more consistent when sending forms ahead of time and using the system more effectively to avoid delays. Even though there were small changes, I realized they can make a big difference in how smoothly the clinic runs. So overall, my practicum helped me understand how different parts of a clinic connects together and how important it is to manage those processes correctly. On this slide, I'm explaining why workflow is important in a clinic setting. Workflow is basically the order of how patients move through the clinic from check-in all the way to check-out. What I've learned during my practicum is that everything in the workflow is connected. If one step is delayed or not done correctly, it affects everything after that. For example, if check-in takes too long or forms are not being completed ahead of time, it delays the medical's assistance. Then the provider runs behind and it ends up affecting the rest of the patients for the day. It also impacts patient satisfaction. When patients wait longer or have to repeat information, they get frustrated, even if the care itself is good. In this clinic, the workflow goes from check-in, then MAs take vitals and patient history, then the provider sees the patient, and then check out. It sounds simple, but even small issues can mess up the whole flow. One problem I noticed is with the patient forms. MAs were supposed to send them the day before, but a lot of times they didn't. So patients would only complete some of them, and then the front desk had to send the rest during check-in, which slowed everything down and kind of became a routine, to be honest. Another example was when they implemented the AI Genie phone system to help with calls. The idea was to reduce workload from the front desk, but in reality, it didn't work as expected. The system didn't always understand what patients needed, especially Spanish-speaking patients, so calls were being delayed or sent to the wrong place. Patients would get frustrated, call multiple times, or even show up upset. That actually created more work for staff and delayed things like refills, scheduling, and follow-ups. So instead of improving workflow, it slowed things down and affected both staff and patient experience. Eventually, they decided to turn it off. So overall, what I learned from that is that workflow is really important because it keeps everything running smoothly. And if it's not managed well, small issues can turn into bigger problems throughout the day. On this slide, I'm talking about communication skills and what I learned during my practicum. One area I personally struggled with at first was communication through Microsoft Teams. When I had questions for the medical assistants, I wasn't always direct or clear in my messages, so instead I would just walk over and ask them in person. While that worked in the moment, I realized it actually disrupted the workflow and it wasn't very efficient, especially in a busy clinic where everyone is already multitasking. As I got more comfortable, I started to understand the importance of being more direct and clear when communicating digitally, especially in a fast-paced environment. I also noticed that communication challenges across the clinic, not just with myself. Medical assistants were often trying to support providers while also handling phone calls at the same time. That made it hard for them to fully focus on either task, and sometimes it caused delays or miscommunication. For example, if a call came in about a refill or a patient question, it could interrupt what they were doing with the patient, which slowed down both processes. What this showed me is that communication is not just about talking, but also having the right systems and roles in place. From a manager perspective, clear communication and proper task separation are really important to keep workflow running smoothly and to reduce stress on the staff. So overall, I learned that improving communication, especially being more direct and using the right tools, can make a big difference in efficiency and teamwork. In our weekly meetings, we mainly focused on three things: KPI performance, digital adoption, and APCM. For KPI, we looked at how the staff was performing and also the patient-related numbers, like how many patients we were seeing, and how the workflow was going. One big issue we focused on, especially at the Denton location, was the high number of phone calls. It got to the point where they even had to add a third person virtually just to help with the calls. So we started trying to understand why were we getting so many phone calls. Was it about medication refills, appointment confusion, or just miscommunication somewhere in the process? To figure that out, we started using ECW more intentionally by labeling tele encounters. Basically, we categorized each call so we could track what patients were calling about. That helped management to see patterns and decide if we actually needed more staff for the calls or if the issue was something else in the workflow. For the digital side, we focused on getting patients enrolled into the Helo app because the clinic was moving toward being more paperless. But what I noticed is that some older patients struggled with using the app, so that slowed the adoption and affected how smoothly things ran. And then APCM was also discussed, which focused on ongoing care for Medicare patients. It's important because it helped improve patient follow-up and also brings in consistent monthly revenue for the clinic. So overall, these meetings showed me how management uses data, technology, and patient behavior to make decisions on improving operations. On this slide, I'm just getting into a little deeper up into APCM and what I learned from it. APCM focuses on, ongoing care for Medicare patients, especially making sure they are being followed up with consistently, and not just being seen during appointments. What stood out to me is that it's not just about patient care, but also how the clinic manages long-term relationships with patients. It also creates a monthly revenue stream for the clinic, since services can be billed regularly as long as the requirements are met. What I notice is that implementing something like APCM takes coordination between staff, proper documentation in ECW, and making sure patients actually understand what the program is. If any of those parts are missing, it can be hard to apply effectively. From a management perspective, This showed me how important it is to balance patient care with financial goals, while also making sure the workflow can support it. So overall, APCM helped me see how clinics try to improve quality of care while also keeping the business side running. On this slide, I'm focusing on ECW, specifically the pros and cons, and also how it was implemented in the clinic. One of the main pros of ECW is that everything is in one system. It helps with scheduling, patient charts, documentation, and billing, so it keeps things organized and easier to track. It supports the revenue cycle because when information is entered correctly, it helps with faster and more accurate billing. But there are also some cons. What I noticed is that are not consistent with how they use ECW. It can actually slow things down instead of helping. For example, if documentation or insurance information is missing or entered late, it can delay claims or create extra work later on. So the system itself works well, but it depends on how the staff uses it day to day. In terms of implementation, I learned that introducing or improving a system like ECW is not just about the technology, it's about the training and consistency. Staff need to understand their role in the system and follow the same process, or it creates gaps in the workflow. From a management perspective, implementation means making sure everyone is trained, accountable, and using the system the same way. So overall, ECW can really improve efficiency, but only if it's implemented and used correctly. On this slide, I'm just going over my practicum project. While focused on ECW, the revenue cycle, and compliance. My main goal was to look at how workflow was actually functioning in real time, especially at the front desk, and how that connects to the system. I started by observing how patients moved through the clinic from check-in to check-out. I paid close attention to where delays were happening inside of ECW. One key area I focused on was insurance verification. The goal was to verify insurances a few days before the appointment, but what I found it's not always realistic with limited staff and high call volume. That directly impacts the revenue cycle because if insurance isn't verified on time or correctly, it can delay claims or cause billing issues later on. I also looked at how pre-visit forms were being handled. MAs were supposed to send them the day before, but a lot of times they didn't. So front desk had to send the rest during the check-in, which slowed down the workflow and created inconsistency. From a compliance standpoint, things like accurate documentation, completed forms, and correct information are really important. When those steps are skipped or rushed, it can lead to errors in the system. I did notice that when call volumes were high or when the AI phone system was being used, it made it harder for staff to stay on top of tasks in ECW, which caused delays in both patient care and documentation. So overall, my contribution was identifying gaps in workflow, connecting them to how ECW was being used, and suggesting that improving consistency, communication, and task timing could help make the system more effective. To close, this practicum really helped me understand how a clinic actually runs on a day-to-day basis. I saw how staffing, communication, and workflow are all connected, and how even small issues can turn into bigger problems if they are not managed well. It also showed me the difference between what sounds good in theory, like certain workflows or systems, and what actually works in real life when you're dealing with the patient staff, time, and time constraints. From this experience, I feel like I've improved in being more observant and understanding workflow better, and thinking more from a management perspective instead of just focusing on task. Looking ahead, I do want to focus more on improving systems, especially workflow and communication, to make things more efficient for both staff and patients. I also want to continue building my skills in healthcare management and apply what I've learned in a real world setting. And thank you so much for watching.